Hello, I am Andrés Javier Perusquia Reséndiz, and I will talk about some policies to reduce childhood obesity. And first off, we have to talk about the real problem, which is that high levels of urbanization, limited access to space and time for physical activity, and a nutritional transition characterized by ubiquitous access to ultra-processed foods with excess calories, added sugars, salt, trans fatty acids, and saturated fats have contributed to an epidemic of childhood obesity in Latin America, and several strategies have been made towards the tackle of this problem, and we will talk about some of them. First, we have the special taxes on sugary drinks and high-calorie foods, and it is worth noting that around the world, taxes on healthy foods and beverages have been used to discourage the intake and reduce externalities associated with unhealthy diets and generate revenue to support obesity prevention. And in high-income countries, the reduction of the intake of these substances has been in some cases around 15% in a relatively short amount of time. And to show the effectiveness of this policy in Mexico, it can be noted that data from urban households and national sales have found a 6% reduction in the consumption of sugar-sweetened beverages in 2014 and 9% in 2015, which shows that this policy is actually working right now. And we have to talk about the front of package food label legislation, that although it is mandatory to include nutritional labels on packaged foods in most Latin America, most consumers report a low understanding of the nutritional data presented. Because of this, the modern focus is on moving from a complex and confusing label to easy to understand front of pack, labels that include clear messages and images. And government regulation in this matter is necessary because until recently, the messages of this package added voluntarily by food manufacturers focused only on highlighting positive nutritional attributes or elements. And it has been shown that in Finland and other high income countries, this front of pack food label legislation has to be followed by a social marketing to be truly effective. And we will talk about now the removal of trans fatty acids from processed foods. As for the consumption of these substances, it has been shown that have increased to have a significant deleterious effect on cardiovascular health, since 2% increase in energy it takes from trans fatty acids can increase risk of suffering a coronary event by up to 23%. And it has been shown in high-income countries, again, that it is more successful than labeling or education policies. And this is the most important, well, it is potentially the most important the most important element to combat childhood obesity because of this, because it is now not up to the consumer, but to the product. And finally, we have to talk about the ciclovías, or open streets. That is a program that temporarily closed the streets to motorized traffic to transform into a safe and pleasant space oriented to people from leisure biking, walking, jogging, and participating in social events. And this is important to reduce air pollution, stress, lack of public safety, and physical inactivity. And studies in ciclovia programs in Bogota and United States have shown that users are more likely to meet physical activity guidelines and report a better quality of life. So the successful dissemination of the ciclovías is due to their popularity amongst the general public based on the strong perception that they improve quality of life. And this results in a political support from city majors and scientific advances in understanding the relationship between urban planning and public health. And finally, I would say that the role of evidence, it is essential to make policies that really tackle the main problems, which are the ones that I mentioned earlier. It is critical to eradicate childhood obesity in order to achieve a better society and a functional society and a productive society. And that will be all. Thank you very much.